you. Good morning, everyone. I'm going to just give a few moments as we wait for people to filter in from the waiting room. All right, it's 11:31, so we can get started. Thank you all for joining Governor Mills's Opioid Response webinar series. What a beautiful day here in Maine today to close out our 2023 series with an amazing presentation from our partners. Today, we'll be hearing about Maine's Recovery-Friendly Workplace program, what it means to be a recovery-friendly workplace. I'm Madison Barassa, SUD Program Manager at the Office of Behavioral Health, working with Gordon Smith on the opioid response work. I just want to take a moment to note that the next two webinar series will be held on Friday, January 5th at 11:30, and then our February series will be on the 2nd at 11:30 as well. Keep an eye out for the registration notice from AdCare to learn more about the topics that were selected for both of those months. Lorena is going to put a link in the chat for an upcoming event at the University of Southern Maine's Lewiston Auburn campus on Monday, December 11th. That event will be from 9 a.m. to 3:30 p.m. on the topic of designing and implementing a recovery-ready community. So again, Lorena is going to put the details of that event in the chat. Just a couple of housekeeping items. If you do have any questions today, please put those in the question and answer box. We will get to as many as we can. But as always, if we don't get to all of the questions, AdCare will post those in on the website in the coming weeks. I'm joined today by some really wonderful people that you'll see here on your screen and hear from in just a moment. One of which I had the pleasure of introducing to you all today. Dr. Larry McCullough is the founder and executive director of PineTree Institute, a nonprofit organization based in Maine that is devoted to promoting well-being for individuals, families, and communities. For the past 5 years, a particular focus has been creating trauma-informed approaches to addressing community challenges in a way that fosters thriving communities. Larry has over 30 years of experience working with businesses and nonprofits on organizational effectiveness and leadership development. He brings this experience to bear in working with the Recovery Friendly Workplace Initiative for the state of Maine. We're very grateful to have Larry join us today, and he will be introducing both Mark and Leslie momentarily. So Larry, I'll turn it over to you.
Great. Madison, thank you very much. And big thanks to Madison and Lorena for all of the work they do. I'm sure many of you have taken part in a lot of these events and know the work that goes into making them happen. So we've always been incredibly grateful to AdCare and to Madison and Lorena particularly for all the work you do. So thank you. And I also want to start by expressing our thanks to Governor Mills and to Gordon Smith, who is the Director of Opiate Response. Many of you know Gordon has been intimately involved with the Recovery Friendly Workplace Initiative for several years now, working on how to best implement it in Maine. Unfortunately, he had a conflict this morning, but sent his regards and has been incredibly supportive of the entire initiative. So big thanks to Governor Mills and to Gordon Smith for their work in making all of this happen. And Madison, thanks for the introduction. Say just a little bit more. PineTree Institute, based in Elliott, Maine, down by Kittery, if you don't know exactly where Elliott is, and has been working for the past few years to help communities address significant challenges, particularly by building coalition approaches that address some of these issues. So when we had the opportunity to think about how best to approach recovery-friendly workplace for Maine, this was a natural fit because it really draws on all of those coalition building skills that PineTree has been working on. And then we have been thrilled to be able to be partner with Portland Recovery Community Center to provide both the PineTree can work with the business aspect, and Portland Recovery Center, PRCC, provides all of that recovery support, so that we really have a true partnership that is implementing this. And we're very excited to be able to do that. And today is a chance to really spread the message about this initiative. So joining me today, I'm going to introduce them and then ask them to just say a few words about themselves. Joining me is Leslie Clark, who is Executive Director of PRCC, and Mark Lefebvre, who is the Director of Recovery Friendly Workplace and works with PineTree to do that. But Leslie, welcome, and could you just say a few words about yourself and PRCC?
Good morning. I'm so happy to be here this morning and so excited about this project and working with PineTree and recovery community and businesses throughout Maine. I'm Leslie Clark. I'm the Executive Director of the Portland Recovery Community Center. We're a recovery community organization providing resources and peer recovery support and advocacy throughout the greater Portland area, and also providing technical assistance and coordination for recovery community centers throughout Maine, of which there are now 18 centers practicing in local communities. I'm also a person in long-term recovery, and as I said, just so excited about this partnership with PineTree and with the state of Maine and this project and going forward. And Mark, I will turn it to you for intro.
Thank you, Leslie, and thank you, Larry. My name is Mark Lefebvre. I probably know many of the folks who are listening in today, but for those who I have not had the pleasure of yet meeting, I am a person in long-term recovery as well. And I've been with PineTree Institute just about 3 years now. And previous to taking on the statewide recovery friendly workplace role, I was the director of, community engagement and directed programs such as the Greater Portsmouth Recovery Coalition. And so it's a pleasure to be here today, and I look forward to sharing this wonderful program and the details and what it means for the state of Maine and for businesses and job seekers in the state of Maine. So thank you, Leslie. Thank you, Larry. And I'll turn it right back to Larry.
Great. Thank you. Thank you both. We're all delighted to be here. So I want to just share a little agenda for the day, the topics that we will cover. So we're going to share a little bit more about the Recovery Friendly Workplace team that is in place to provide the support for this program. And then we'll really introduce the concept of Recovery Friendly Workplace and talk about why it's so important. And part of that is the benefits to business that a Recovery Friendly Workplace initiative can provide. We'll then share with you some of the criteria that have been established, criteria that are clear, but also really simple, because the goal is to encourage as many businesses to participate as possible. We'll talk a little bit about the program rollout to date. The official start was July 1st, and a lot of preparation has gone into our time, and then talk about the status and timeline of how this moves forward. So that's our topics for the session. Just by way of overview, what is Recovery Friendly Workplace? Many of you have probably heard the term. We love the description of it, which is recognizing that Maine employers who commit to implementing foundational changes in the way individuals living in or seeking recovery from substance use disorder are hired, treated, and supported. And there's just a couple of things that I want to highlight about this description that is really important to understand and addresses sometimes misconceptions about Recovery Friendly Workplace. So this is for individuals who currently are living in recovery, many of whom are employed, and you'll hear some of the statistics on that, but also people who are seeking to enter recovery or maybe newly recovered and not yet employed. There's sometimes a misconception that this is for people that aren't employed, to get them employed, but you'll hear that substance use disorder impacts all of our businesses and all of our families. and it's for everyone who is part of that. So it's important to understand that, and I love this description. Yeah. I want to introduce the team that is in place to support. So the way the program is structured, this is managed by the state of Maine and is funded through the state of Maine for the core services that are provided. And you'll hear a little bit more about exactly what that is. There is a partnership between PineTree Institute and Portland Recovery Community Center. PineTree, I'm executive director, also serve as executive advisor to the program. Mark Lefebvre, who you hear from in a minute, is our statewide RFW director, and Catherine Rawson is the Maine statewide RFW business advisor. You'll hear a little more about what that role is. And of course, we have Leslie Clark here, executive director at PRCC. Working with PRCC is Nicole Proctor, who is the Recovery Hub program director, and Justin Reed, who is the statewide RFW recovery advisor. And you'll see even from this description of team members that there's support both for businesses and for recovery. This is a double approach. We are supported by a really powerful advisory board, including 22 leaders from business, workforce development, education, and industry. And these are supporters who support this initiative, but are also advocates and champions in the larger community for encouraging this effort. So I'm going to turn it over to Mark to really talk about what it is, why it is, and how it benefits businesses. So, Mark.
Thank you, Larry. Thank you, Larry, for that transition. So what is a recovery-friendly workplace, or what is the program Recovery-Friendly Workplace, rather? It's a national program which originated in New Hampshire under the Governor Sununu administration in 2018, and it's still going strong. Currently, there are somewhere in the neighborhood of 330 businesses within the state of New Hampshire that have been designated as recovery-friendly workplaces. And New Hampshire is kind of leading a federal community of practice, of which Maine is a member. But as of yesterday, we just had a community of practice meeting this week. There are now 35 states in the United States, as well as a Canadian province, who have been adopting recovery-friendly workplace in various implementations. Maine, like I said, is one of the most recent states to be added to the community of practice. And one of the really cool things that the team from New Hampshire has done is they've created this platform, a community platform for all of the state implementers, of which anybody that's attached to executing this program or implementing this program in Maine is a member. And it offers an opportunity to ask questions, to gain insights from what other states may be doing. We can repurpose content for our own particular program. All of us are collaborating with one another so that nobody has to reinvent the wheel from square one. And I've included a screenshot here of what that community platform looks like. And the reason why I wanted to emphasize this is one of the ideals of this Maine Recovery-Friendly Workplace program is to establish a statewide community of practice where businesses and job seekers can come in and ask questions, get the help, some resources and so forth, so that, again, as we scale this across the state of Maine, we don't have to start from square one every time we approach a new region of the state. So why is a recovery-friendly workplace important? According to the federal government, over 60% of Americans 18 and older, so that comprises almost 27 million people that are dealing with substance use disorder, are employed. And of these, almost 78% of those, in other words, 21 million, work full-time. So on average, if you look around your business or your workforce community, there are many of us that are out there that are either visibly in recovery and publicly embrace that. There are others that might be on the fence. There are others that perhaps aren't ready. But nonetheless, businesses have an opportunity here to provide an open and healthy environment, a welcoming environment for people who are either struggling or have somebody at home that are struggling. And the benefits to businesses, which I'll quantify in just a minute, that the benefit, untreated substance use disorder in the workforce, the cost is associated with missed workdays, reduced productivity, increased disability, time off, and higher healthcare and turnover costs. And we'll show you what that means. In the next chart, I'm going to actually take it down to the state of Maine. And according to the Maine CDC, they did a study on Maine workplace substance use and tobacco comprehensive needs assessment back in 2022. So this data is very, very, very fresh. What you see here on the left-hand side, they interviewed almost 500 employers / businesses, as well as employees that are in high-risk industries with regards to substance use and wellness policies. And the data from that survey showed that 70% of workers in the state of Maine use alcohol on a weekly basis. Nearly 50% of Maine workers use cannabis on a weekly basis. And perhaps most alarming, that 50% of the Maine workforce uses illicit substances on a weekly basis. The message here is that those people that are struggling, or those instances of substance use and alcohol use, are prevalent in just about every business across the state of Maine and across every industry sector. About 2/3 of these businesses some workplaces report as many as 2/3 of the folks that are in their business as being in recovery. And my guess is those are fairly small businesses. And then 47% report having recovery programs in their place of work. And then moving to the right-hand side of this chart, 81 of the businesses that were interviewed report having EAP programs, either on premises or contracted. 92% of workers within these businesses receive medical benefits. And then again, one of the striking statistics that came out to me is that over a quarter of these businesses in the state of Maine are currently hiring those that are justice involved, or those that have criminal backgrounds, which to me, as somebody who's in recovery and who's very engaged with the MERN program across the state of Maine, there's a very large untapped workforce of skilled and talented people out there that are facing barriers as they enter the workforce, and hopefully this program will help mitigate that. So the results and the recommendation out of that CDC Prevention Advisory Council is that, using the New Hampshire program as an example, they're recommending that we implement recovery-friendly workplace across the state of Maine, such as enhancements to the EAP structure across these businesses, provide training and education, not only for staff and businesses, but for workers as well. And then provide peer recovery supports, and then provide incentives to employers to adopt the model. And the incentives that we believe will encourage businesses to come forward are the savings that can be achieved. I mean, if you look at the next chart, the bottom line is that recovery-friendly workplace is good for business. And workers that are in recovery save the company a significant amount of money. 3 examples here. Workers in recovery help businesses avoid $4,000 in turnover and replacement costs. That's in somebody being either terminated or going on disability or leaving the business because it's not a recovery-friendly environment. And then that business that needs to go out and hire somebody else and train them and go through that whole cycle again. So individuals in recovery help businesses avoid over $4,000 in turnover and replacement costs. Workers in recovery also miss, on average, almost 2 weeks less per year than people who are struggling with substance use disorder that don't come forward. And that's in the context of, people who are finding help, they're becoming healthy, they're getting back on their feet, and they show up for work. And then the third category here is that each employee who recovers from a substance use disorder saves that business over $8,500 on average for the life cycle of that person working at that business. So as you can see here, the financial and quantifiable benefits to a recovery-friendly workplace is real. So how will we offer Maine recovery-friendly workplaces with this program? I'll go through this rather quickly, but you can see, and I've highlighted in the colors here, the key element of what we provide. But we offer structured but flexible engagement model, and we truly customize this for your business. We provide connection for you and your employees and your staff to statewide and local resources. We help identify and coordinate and make referrals to community and state partners to help you expand your access to direct recovery supports within your community. We're going to be providing tools and materials in the form of training and toolkits that will be specifically curated for you. We provide peer support for employees and loved ones. We offer trainings to you at no cost, and we help establish and nurture peer connections for your employees within the community. And then finally, we commit to an ongoing dialogue to hopefully respond and adapt this program to the specific needs of your business and the needs of the community of which you operate. All of this, I need to emphasize, is offered to recovery-friendly workplaces at no cost. So how are we approaching this in the state of Maine? I'm going to turn this over now to Leslie. I think I may have I took over that last chart on the, unfortunately, Leslie, I apologize for that, but here you can talk about the program and how we're implementing it in the state of Maine.
Thank you, Mark. I appreciate that. Yes, we are looking forward to supporting recovery-friendly workplaces with businesses and with this very flexible engagement model that is here in Maine. The way we are proposing, or we are moving forward with this, is with a coalition of local hubs approach. So you see on this map, the white circles are where there are currently existing recovery community centers in those communities. So at the statewide level, PineTree and Portland Recovery Community Center with our team, the team that Larry introduced earlier, will be providing the statewide coordination, common framework, best practices, toolkits, training assistance for community coalitions, and developing materials that then can be adapted and very flexible, as Mark said earlier, for each community. And then within the local communities, those can be translated into the program management at that level, with these local hubs, the recovery community centers being there as a place of point for both business and recovery, and onboarding, employee services, training people, and providing linkages to direct peer recovery support for people who need them within the workplace. And I think just also to build on to what both Mark and Larry touched on, is as people are more and more visible and cultures within workplaces are transforming, Brad from Kenny Bunk Savings talks about people who start to become known as lighthouses within the organization, people that are shining that light of hope, that are out there and open about their recovery. And it becomes okay to talk about it in the workplace, for people to know who they might just go and talk to and get some help from and connect with others. So for the next slide, Mark, are you picking up this one or am I? You go ahead. Okay, I think this one was yours. Okay, thanks.
Thank you, Leslie. So just to put this into a little bit of a timeline or approach in terms of our phase 1 priorities. So what we're really doing at this time is building capacity across the state for communities that have either been running pilots before the grant was issued for the statewide recovery-friendly workplace, or have the capacity to provide the business advisor function as well as the recovery advisor function. So essentially what we're trying to do here, Larry mentioned Catherine, who's the statewide business advisor, and Justin, who's the statewide recovery advisor. They will be working with communities across the state to build the capacity for those two functions respectively. So the business advisor provides outreach, and onboarding and guidance of the journey of becoming a recovery-friendly workplace for businesses. And Justin will be coordinating and providing peer recovery services, training, and help with local navigation of recovery resources at the community level. So in phase one, Lewiston, Auburn, we'll talk a little bit about some of the progress that we've made there, but we've got a capacity there for both recovery advisor and business advisor. And we've been running a pilot there for the last 18 months through the generosity of the Sewell Foundation that helps shape what the statewide model. So they're up and running. Washington County has been operating a pilot up there through the Community Caring Collaborative. Those of you who know Abby Frucci and the folks that are up there have done some tremendous work designing a recovery-friendly workplace program that makes the most sense for that rural environment. In fact, we're going up there on Monday to help breathe the statewide initiative and to amplify the work that they've already done. Likewise, Greater Portland and Cumberland County, you know, that's kind of the home base for PRCC. PineTree Institute, and our resources are really close there. So we've got the capacity to bring those communities along the Recovery Friendly Workplace Initiative. And then what we're kind of having the background here that we're looking and having some progress is York County, in that there's some work underway of establishing York County as a recovery ready community. And from that, we'll have peer recovery resources out of Sanford, and business advisor, because it's in the backyard of PineTree Institute, which is in Elliott, we'll have some capacity there as well. So phase one is focused on these communities. However, if there's a region, my message here is that there's a region of the state that has an interest in establishing and assessing whether you have local capacity. As an example, we're having conversations about running a pilot in Aroostook County as a result of some of the folks that they already have on board there that can learn and become educated on doing the statewide model locally for a number of businesses. So we're putting together a statement of work there about running a pilot. And that's kind of the message that I would throw out there to anybody that may not be included in this phase one rollout, is if you can help us find a way to raise local capacity around the business and recovery advisor functions, we can do limited pilots and help scale your location as well as we build these other communities here. So what is the criteria for becoming a recovery-friendly workplace? As Larry mentioned, it's intentionally designed to be an easy lift. The initial requirements are the business would submit a letter of interest to the program office, and that could be to any one of the individuals that Larry cited up front. But we do have a landing page that I'll show you towards the end of this presentation where you could inquire and make an inquiry. We would do an orientation with you. You know, either if it's a mom and pop, we'll have an orientation for mom and pop and all the kids that work there. If it's a corporation, we'll start with HR and go from there. But the orientation material is just basically explaining what the program is, what's the business value, a little bit more detail in terms of what it is that we provide in terms of training and so forth, and then steps to go forward and become designated. At that point in time, the business makes a decision as to whether they want to declare internally to their business that they intend to become a recovery-friendly workplace and what that means for that business. We have a template, but businesses have been adapting that template and putting in some language that's fine-tuned to their specific needs. Once we get a proof of that declaration in the form of an email or a screenshot or whatever, you're designated. We send you a welcome kit, soft copy, and then we put one in the mail that's hard copy. I'm going to do a show and tell here. I didn't even think of pulling this out, but since I have it handy, we have a folder that will be mailed to the business that it'll contain all the instructions in terms of, you get a welcome letter, you'll get the criteria for, the things that you're responsible for as a business as a result of being designated. You'll get a label for your window of business. We can send you more than one if you have multiple locations, and we'll send you a bunch of these decals that can be stuck on the back of your laptop, your monitor, your coffee mug, whatever. But it's to help socialize and celebrate your designation. There'll also be some information in there in terms of local resources, who do you call, and so forth. So that's basically it. Those 4 steps, letter of interest, orientation, declaration internally. You send that declaration to us. We designate you as a recovery-friendly workplace. And you can see here to the right, the logo that we developed that demonstrates the collaboration between businesses, community, and job seekers across the state of Maine. Additional things that we would ask you to do is, excuse me, is to take information and resources that we provide and distribute and celebrate those within the business, connect to your local recovery community center, and attend the education and training that will be provided to you at no cost. And some examples of what that training might be is Substance Use Disorder 101, how to spot and respond to a situation within the workplace, ADA requirements, since substance use disorder is a diagnosable illness, and the rights that individuals that declare that they're struggling with SUD, what rights they have in the workplace. We'll also provide training that's optional in the form of Narcan training, and maybe putting on the locks box in the workplace next to your AED boxes, and anything that might be customized for your particular business needs. And then we ask you to get involved in the community, whether it's statewide activities, participating in recovery events, community events, and just celebrate the fact that you're identified as a recovery-friendly workplace. So let me tell you a little bit about where we are and how we got to where we are. So as Larry mentioned, we started back in early July with a team of 1.5. In that time frame, we've staffed the plan. We've completed and socialized the recovery-friendly workplace model. We have the logo that we have in place. We have outreach presentation and materials. We have the designation checklist, which is essentially the steps that I just showed you in the previous chart. We have a landing page for our website that we're going to continue to build. And as we take on more recovery-friendly workplaces being designated, we're going to have a nice crawl at the bottom of the web page that shows your logos in real time going across the website as we celebrate your status as a recovery-friendly workplace. We will have the first of the first 4 training modules available in January. So we'll start training our recovery-friendly workplaces in early January. And in that time frame, we'll have a recovery-friendly workplace toolkit, which essentially provides you with hot links to hyperlinks to resources, best practices, topical things that might be of interest to you. And in time, we'll develop a newsletter that kind of goes along with that. So I'm pleased to announce, we announced earlier this week, I think it was on Monday, it might have been Friday of last week, that LePage Bakeries was the very first Maine recovery-friendly workplace designation. I'm pleased to announce as of 8 o'clock this morning, right off the press, that Tri-County Mental Health of Lewiston is also a recovery-friendly workplace. We have a number of businesses here that are listed that were logoed under the New Hampshire model, because they have presence in New Hampshire, a supply chain that's in New Hampshire, or customers that are in New Hampshire, and we're going to grandfather them in over the next week or two. So Kennebunk Savings Bank, Better Life Partners, Groups Recover Together, Nonantum Resorts, Maine Works, Portland Recovery Community Center, and PineTree Institute. And then we have a number of businesses in Washington County, as well as in Lewiston, Auburn, that are in the cycle of going through the checklist items. So whoever's providing the hearts and the horns and the balloons and everything in that chart, thank you for that. We're as excited about this as you are. So what can you expect over the next 6 months? And this is in no order of priority, but marketing and outreach. We want to continue to build a statewide awareness. We'll be participating in job fairs, recovery-ready community events, anything that you all think is important enough to get this message in front of your community. We'll hop in the truck or hop in our cars, and we'll make the trip up there and do that. We're happy to do that. Just doing a time check here. We'll be creating and distributing marketing materials. We'll be beefing up our website. And again, speaking engagements and events we'll be participating in with tables and handouts and so on and so forth. Excuse me. We'll help build them. I mentioned the Maine community of practice. So we'll develop and deliver trainings. We'll develop and deliver the toolkits, and hopefully we'll have an IT backend community platform that we can kind of replicate what New Hampshire has done for statewide implementers, and then build local hub capacity. And this is really going to gate the rate and pace that we grow statewide. We'll be developing resources within the local hubs, that being the recovery-friendly business and recovery-friendly recovery advisors. We'll hire and train these, or connect and pull in and train these as part of the program. And then, of course, onboard new recovery-friendly workplaces, which at the end of the day is only the first step. The logo and the label and all the nice literature and all that stuff and the designation, that's really, really important. But the real benefit is in the training materials and the toolkits and the peer supports that we'll be providing to you at no cost. So I think I'm a few minutes early here, but what you see here is a flyer. That flyer is available, and we'll put that up on the website so that you can download it. We'll also put the contact information in terms of all the contact information in the presentation material that Lorena had sent to you. You can hover over that info at, it will connect you right to our recoveryfriendlyworkplacemaine.org website. I'm available at any time to meet with you, as is the rest of the team. Larry and Leslie, and by extension, Catherine and Justin and Nicole Proctor are all available. And if you have any questions as we go on, we'll be happy to field those. So I guess, Madison, I'm going to turn it over to you, get a drink of water, and maybe give Larry and Leslie a closing opportunity to say what they think they might want to say.
Yeah. Well, I was actually going to just jump in and invite Leslie. We've talked about this so much. Leslie, wondered if you wanted to share a few other comments from the perspective of PRCC in terms of why you have been so passionate about this program and why you see it so important for businesses.
Thank you, Larry. I appreciate that. I think from the perspective of PRCC and the recovery community centers throughout Maine, one of the biggest issues, probably the biggest issue that we hear about over and over as the barrier to people seeking help, is stigma. And that stigma, although things have become much better, is still very, very real. And so I think this program just takes it to a whole new level of having businesses and the kind of credibility that businesses bring in communities, that the businesses together working with the recovery community are bringing recovery out into the open, that there is hope, that there is help, that there's no reason to feel like people can't talk about these things. Those statistics that you provided about the number of people who are currently using substances to the extent that they are. And a lot of those people probably don't have a problem with them. Probably most of them don't have a problem. But for people who do have a problem and it's interfering at work, just being able to know that it's okay to talk about it, and there's a place to talk about it, and there are places to get help, and that there are people who, ultimately the essence of the work that we do, those of us in recovery and peer services and at the recovery community centers throughout Maine, is that we are filled with people like myself in recovery who have been in those shoes. Like, we have been in that situation ourselves, and we know what it's like. And we know that there's a way out, and there's this whole beautiful life that people can have. So I think with that, I'll just end with that, because I do think that this is a huge stigma buster. I think employers find this really hard to manage and they have the compassion, but they also need to get their work done. And just one other piece, and I know I just said that was my last comment, but also in Maine, we have very large employers statewide, and they have a lot of capacity to do this kind of programming. But we also have many, many small businesses, mom and pop shops. And, I think sometimes the impact there of having an employee who's struggling and they're like your family and not knowing what to do, this is going to be a great resource for them as well.
Great, thank you, Leslie. These are the perspectives. We have heard such moving stories of individuals who have been in a workplace where that workplace has been supportive and has been able to help them work through particular issues through accommodating needs or supporting time off if it was needed, and how this can help really turn around lives. That's what gets me excited. I hear the stories, I see the potential for people being able to be really productive with a little bit of support and a big amount of understanding of what the issues that people are dealing with are. I will also say as Mark mentioned earlier, PineTree also works with groups in New Hampshire. We recently had a workplace survey completed in Seacoast, New Hampshire area, and a disturbing number for me was that more than 50% of the businesses said that they had no issues with substance use disorder, which means to me that probably people are not talking about it. So one of the big impacts, and this gets back to what Leslie was saying about stigma, is just creating a safe space to be able to talk about it and help people understand what the issues are. Because we know from the research that Mark showed earlier, 70% of the people who are struggling are currently employed. So many businesses have this issue, but may not in fact realize it yet. So that's another thing that I get very excited about, being able to be involved in this and the impact on our communities. So Madison, I think we can turn it to you. I've seen some questions coming through. Some of them have been answered, some have not. So we'll turn it to you to steer us.
Yeah, no, that sounds great. Thank you so much. And we really appreciate you all and all of the work that you are doing. It's very clear from all of the reactions that you received on the Zoom today, from the hearts to the cheering and the clapping to there's another comment in the question and answer, just very enthusiastic. Yeah. So I really appreciate you all taking the time to be here with us today and doing all of this work. I think it's going to be very impactful, and very excited to see how this comes out. So we do have some questions, and Leslie has done a wonderful job as we are kind of going through the presentation on answering some of these questions. We have had a couple about the presentation itself being available and the recording of the webinar. So I'll just say for the entire group that it is always uploaded onto the AdCare website. I did put the link to AdCare's website for the summit in the question and answer for folks. Usually it takes a week or two for that to be uploaded, but just keep an eye out for that. We have had a couple of questions in regards to transportation and how transportation causes some barriers for folks who are looking for employment or are in the midst of their employment, and how, again, that just causes barriers for individuals. So I don't know if you all want to talk a little bit about transportation and what you all are doing with that.
I'll jump in a little bit, and then I'm sure Mark and Leslie have comments as well, because this is, in fact, literally every discussion we have in Maine about recovery, this topic comes up. Transportation, housing is also a huge issue. The homeless population is growing. It's not directly linked to this, but sort of associated. And then, of course, employment. But transportation is a key to that. As I mentioned, we're involved in a couple of coalitions that engage all of the members of a community to address this. And Mark mentioned one for York County, looking at helping York County become what we think of as a recovery-ready community, which addresses all of these issues. And I was literally in a meeting yesterday where the issue of transportation came up. The usual solutions for a more rural area of adding bus lines or adding transportation just don't work. They're not cost effective. The routes don't match, the times don't match, and the ridership doesn't match. So finding some novel ways to address transportation is a big priority. And I know that one of the things that the York County Coalition specifically is going to be addressing is trying out to pilot some models of some different approaches in transportation. I think in areas like Portland, maybe it's a little bit different, maybe in Bangor, but York County, most of it is more rural. And it's even though it's more populated, it still has the characteristics of rural communities. And the transportation issue has not been solved. So Mark and Leslie, I'm sure you have thoughts on that as well.
Yeah, my only comment to add to that, Larry, is that it really needs to be addressed at the hub of the community level. And so some communities have bus lines, some don't. Some communities have access to Uber, some don't. Some have rideshare, some don't. So my only point here is that in the context of the Recovery Friendly Workplace program, there's no panacea, and it's not something that we can drive programmatically. This needs to be addressed at the community level through our partners within that community.
Yeah.
Wonderful, thank you. And I know Leslie had responded to one of those questions already, but it got brought up again later on in the question and answer. There are a lot of people connecting in the question and answer box as well. So really appreciate folks putting their emails in there so we can get connected to you all or connect to each other. I think that's really important. I'm just going down through here. There's one specific question. How does one start up a hub?
By calling myself, and we'll have a discussion with, that will include Catherine and Justin, and see what we can do to assess the capacity locally and come up with some sort of a game plan that makes the most sense for your community. So you would start by inquiring at the info at Recovery Friendly Workplace Maine link that's on the landing page, or you could email me directly, and I'll I don't know if there's no chat here. My email is I should have put it on the chart.
That's okay.
Yeah, you can
We'll
find
get it
us.
out.
Yeah, we will get it out for sure.
Madison, there was a question also I saw about people who had been incarcerated. And I thought I might, maybe we could talk about that a little bit.
Absolutely.
Because I think that's such a big part of this in terms of recovery friendly workplace and educating employers to really give people a second chance. Like really, when you're looking at a resume, and for example, and there's a gap of a couple of years, or after, getting ready to hire someone or thinking of hiring them, learning. Of course, we've made progress with the law, so no longer asking people in terms of the beginning, but at some point, if on a application, but if at some point becoming aware that someone does have incarceration, really recognizing that if that was a part of their active substance use, and they are in recovery and doing well, it's just go back to the second chance. Like everybody needs that second chance, and understanding that what great employees someone can be who has recovered from substance use disorder. But part of so many of us, our stories involve having been in jail or in prison. And it's a huge, wonderful, untapped resource for communities to really look at how to connect people coming out of jail or prison to employment and help be part of the solution for them, but also because they make great workers.
Thank you so much for that, Leslie. All right. I see Mark is responding to one in the chat, into the question and
Oh,
answer.
okay,
Mark,
you
do you
all
want
are
to
right.
do you want to take that one to the group as well?
Yeah, so Corey Mason asked the question, will let me see if I can find it. There it is. I must have missed it. Where did I go? He asked the question as to whether or not we'd be working with businesses to establish policy and practice around transportation. And the response, wherever it went, is that the Recovery Friendly Workplace Program will work with businesses in all areas, including transportation, housing, childcare, clothing, and other elements that represent barriers to the program. It's not in the scope of this program to dictate policy, but we can help inform those businesses as to why, what resources are in the community to help address those barriers. So yeah, it's not in the scope of what we're doing, but we would work with the community level to address transportation, housing, childcare, and so forth, because those are typically the top 3 or 4 barriers that businesses identify as being a gate to having a workforce development, a healthy workforce. So I don't know if that answered the question, but it takes a community.
So much. Another question coming in from Daryl Goldrup asking if the information will be sent out to all caseworkers within the DOC, assuming that means just collaboration within the Department of Corrections. Daryl says, I'm at Baltic as a CTI, and I know connecting folks getting out would be huge.
Thank you. I just would like to mention PRCC, we work with the DOC for recovery programming throughout all of the different locations and with the residents directly, and training them to be coaches and knowing all the resources and working really closely with staff there as well. So we absolutely will be making sure that this goes out to everyone and that they're included in the programming, as also with Maine reentry and working with Bruce Nodden and some of the reentry work that he does. And I think that's a really important piece. So yes.
Wonderful, thank you.
See a question from
Go ahead,
David
Larry.
Delaney. Oh, go ahead.
Well, so I just wanted to say quick, where there's several offers of places that want to start up and several questions about how to start up. And just wanted to say quickly that anyone who is interested to reach out, and there are steps and processes that people go through. There may not be a full hub in a particular area, but there are ways that businesses can participate, start to learn about the program. And we are learning about how best to scale this on a statewide level as hubs begin to become available. So don't worry about the map. If you're interested, or you know a business that is interested, have them contact the Recovery Friendly Workplace team, and we will make sure that people get connected one way or another. So just wanted to do some reassurance there. And then Mark, you had another one that you were going to be in.
David Delaney, great question. Does PineTree work with employers in any kind of restorative justice model? And does that model come up in our work at all? The answer is yes. We are a valued partner of the Maine Reentry Network. We have been probably a year and a half before the grant was issued, and working on these issues. I would say though, David, we're still building our statewide partnerships that, and these are not all inclusive, but voc rehabilitation, restorative justice, Department of Corrections, the clinical community, cities and municipalities. I can go on and on and on. What we envision is that each of these hubs will have a 360-degree network of relationships that feed and support this program through work that's already being done there, as well as identifying gaps. But at the statewide level, we still have a lot of work to do to establish those state relationships, such as restorative justice. But the answer is a resounding yes.
And Mark, there was another question in the chat related to transportation, specifically to help employers. It looked like it says that you'd like to answer that question live, so I didn't know if you want to take an opportunity to do that.
Oh, I think that was a question to Corey that Corey posted. Yeah, I'm a moron when it comes to all these buttons and options. I'll
That's
screw this
okay.
up if I click on too many things.
That's all right. Can go through here. A lot of thank yous for all of the information today, and a lot of just comments of, again, folks eager to get involved and how to do that. When we send out all of the information, the recordings, and the presentation, we'll ensure that everyone has the ways to get connected to the folks you see here on the screen today, so you can do that. I'm not seeing any other questions. Were there maybe any of the answered questions that you've, Mark, Leslie, or Larry, that you'd like to just kind of talk a little bit more in depth about? Like I said, y'all have done a great job kind of going through those questions as we were going along, but we do have a couple more minutes.
Yeah, I would just say in general, first of all, thank you. This is kind of our coming out party. And, we've had various instantiations of this in localities, but this is the first real statewide. We're learning as we're going, and we're adapting as we go. And you all help inform what it is that we need to do to respond to this particular opportunity. I'm not calling this a problem. This is an opportunity. We have an opportunity here to make a profound difference in the way that businesses get the help that they need so they can run their business, yet at the same time be supportive and be welcoming for a healthy work environment, including people that are in recovery and including people with justice involvement backgrounds.
Well, I'll just take oh, go ahead, Larry.
Well, I was just say sort of a final comment from my perspective. The state has been thinking about how best to pursue this over the past couple of years. As Mark said earlier, New Hampshire's effort started 5 years ago. There's a number of states. There's now a national effort, Recovery Friendly Workplace. So it's exciting to know that Maine is really embracing this, with some of the challenges of Maine being a really different state than New Hampshire, with a really different way of implementing. And we're pretty excited that over the course of developing the plans for this, that a plan has emerged which looks really solid and really accommodates some of the needs of Maine. What I also want to sort of piggyback on what Mark is saying is we want to also emphasize that Recovery Friendly Workplace is one piece of what needs to be a much broader community strategy. So if we look at the very impressive statewide strategic plan, all of those pieces really need to work together. So we encourage everybody on the call. I know not everybody on the call is a business owner, but you all know business owners, and business owners have often not seen themselves as part of the solution to this issue. So I think part of what I get excited about is, mentioned earlier, a lot of my background was working with businesses, is helping businesses see for themselves a place at this table, that it's not just we're going to go off there and the service providers are going to fix all the problems, that as a community, we are all engaged in this effort. So one of the reasons I'm excited about this is that it provides a very concrete way to invite businesses to come to the table and be part of the conversation of how, as a community, do we address these issues overall. So that's what I encourage everybody on the call. Reach out to your business friends. We all shop at businesses, we go to businesses, we buy things. And this is a great way to reach out and say, hey, we want to partner, and we would like you to partner with us as we address these issues as a community. That's what I see as the real invitation of this program. So I'm very excited that everyone is here, and encourage you to all be champions and ambassadors as you go out. And thank you again to Madison, Lorena, Governor Mills, and Gordon Smith for making this possible. We are so excited that we had this chance to present with everyone. And I love these floating floating hands and hearts and thumbs.
Amen.
Thank you for all of those.
All of the reactions, all of the love. I think that's a testament to the work that you all are doing here, and really appreciate. Want to say thank you from myself and from Gordon, the Office of Behavioral Health. Thank you, Mark, Leslie, and Larry for being here today and presenting this really great information. Thank you to AdCare and Lorena for helping us put this on, and thanks for everyone for joining us today. It's such a beautiful day here in Maine on a Friday, 11:30, starting off December such a great way. So appreciate everyone being here. And if you have any questions, please feel free to reach out to myself, Lorena, and we'll see you all in January. Everyone have a nice holiday season as well. Take care.
Thank you, Madison, and everyone.
Thanks, Madison,
Great to be
Lorena.
here.
Thanks all.
Thank you.